I went into medicine because growing up in the Bronx, I am the youngest of three, the only girl, and my older brothers, one of which always had really bad childhood asthma. And at the time, we had an amazing pediatrician, and she really educated my parents as well as my siblings on the best treatment and management for their symptoms. And at the time, I always felt like I wanted to be that person in someone's life, and I can really see the joy in her eyes whenever she would talk to my parents. So I always wanted to feel like I can be that person for someone. I was really drawn to primary care, mostly because during my medical school rotations, I was always that student who asked, what's going to happen after the patient leaves the hospital or when they're no longer coming to the office? I was always very curious as to their long-term treatment. And as a primary care physician, I love that I get to make lifelong connections with my patients, and I get to follow them, whether it's after a hospital or even after an office visit. My approach to patient care is to use preventive medicine as well as evidence-based medicine to make a plan with the patient. I often find that when using shared decision-making, it's best for the patient because they often stick to the plan. I would say the most rewarding experience about my job is having patients come back to the office and sharing their own experience, especially after they followed the plan that we both agreed on. Often patients come back and they're extremely happy and they feel happy, but also you can tell by their labs and imaging that things are actually getting better.